In keeping with our general well-being, the kidneys, those bean-shaped organs buried away in our lower back, are overlooked heroes. These often overlooked organs work tirelessly to regulate blood pressure, keep electrolytes in balance, and filter waste. However, our daily behaviors may drastically impair their health, resulting to long-term harm. How much water we drink and what we eat are two examples of the many lifestyle decisions that have a significant impact on kidney function. The key to maintaining kidney health and avoiding chronic kidney disease may lie in understanding and changing these practices. So, let's delve in and reveal 12 common habits that are detrimental to your kidney health, uncovering how each one takes a toll on these essential organs in today's video. Always remember to check in with your doctor if you have any concerns regarding your kidney health. Alright, then, I'll begin. 1. Not drinking enough water. The kidneys are extremely important because they filter the blood and remove waste materials. A reduction in blood volume and a rise in waste concentration characterize dehydration. This increased concentration makes it difficult for the kidneys to adequately filter these chemicals, resulting to their buildup in the body. Kidney stones and other problems may become more common as a result. Also, muscle breakdown due to dehydration might release myoglobin into the circulation. The kidneys filter away myoglobin, but in high numbers, it may develop deposits in the kidney tissues, leading to inflammation and injury. In a research including 12 healthy people, the influence of water on renal function was studied. Participants followed both a low hydration diet of 0.5 milliliter per kilogram of body weight and a high hydration food plan of 4 milliliters per kilogram of body weight for every alternate 30 minutes. The results revealed that higher hydration levels lowered the glomerular filtration rate, a crucial measure of kidney filtering effectiveness, and increased salt output. 2. Overuse of painkillers. Painkillers work as saviors at tough times, but they also injure the kidneys, especially when used in excessive amounts or over a lengthy period. They may limit the blood supply to the kidneys, decreasing their capacity to function effectively. A recent study, encompassing almost 11,000 originally healthy males, ranging in age from 40 to 84, evaluated this topic for more than 14 years. The research discovered that males who reported consuming 2,500 or more analgesic tablets, equal to 3 or 4 pills a week, were no more likely to exhibit evidence of kidney impairment than men who seldom or never use such medications. However, more than that quantity may harm the kidneys if taken without safeguards. 3. High salt intake. Consuming too much salt makes it harder for the kidneys to eliminate fluid, resulting to fluid accumulation in the body and high blood pressure. This syndrome stiffens and narrows blood arteries, decreasing blood and oxygen flow to important organs. Over time, it may damage the kidneys' filtering mechanisms and lead to scarring, reducing their capacity to control fluid. High salt consumption dramatically impairs kidney function by affecting glomerular hemodynamics, the mechanism by which the kidneys filter blood. Such consequences are especially problematic in people with high salt sensitivity. The development of renal injury is considerably greater in these populations. To avoid these dangers, physicians recommend a low-sodium diet, preferably not surpassing 1,500 mg per day for most individuals. This diet helps regulate blood pressure and minimizes the stress on the kidneys. 4. Too much alcohol consumption. Think about how your kidneys will feel the next time you go a little overboard at the bar. Excessive alcohol use might lead to damage to the kidneys. Alcohol is a poison that your kidneys need to filter out of your blood. Drinking too much can overwork these organs, producing acute damage to the kidneys or, over time, chronic kidney disease. Alcohol also dehydrates you, which affects renal function. Always drink in moderation to safeguard your kidney health. 5. Smoking. Smoking may interact with drugs used to treat high blood pressure, which is a primary cause of kidney damage. It also slows down blood flow to important organs. This lower blood flow hinders the kidney's capacity to execute their vital duties properly, such as filtering waste from the blood and managing fluid balance in the body. A research including roughly 200 patients, conducted over 4 years, investigated the influence of smoking on chronic kidney disease. It discovered that smoking greatly enhances the risk of chronic renal disease. Current smokers showed a greater risk compared to non-smokers, especially those with a high cumulative smoking history. The risk was greater in cases of hypertensive nephropathy and diabetic nephropathy. 6. Excessive caffeine consumption. We all love our morning coffees, but did you realize that much coffee can be hurting your kidneys? When ingested in big quantities, more than 3 cups per day, it may boost potassium levels. An 8-ounce cup of black coffee has 116 milligrams of potassium, and adding creamers or milk further boosts this value. This mineral is necessary for the healthy functioning of the kidneys and muscles as an electrolyte. However, when blood potassium levels are high, these systems may be compromised, putting our bodies at danger. A research comprising nearly 5,800 overweight or obese senior persons with metabolic syndrome explored the influence of coffee on kidney health. It discovered that consuming more than 2 cups of caffeinated coffee or at least 1 cup of tea daily linked to a larger decline in kidney function over a year compared to those who drank less. 7. High sugar diet. Dietary choices may have a significant influence on our health, particularly on key organs like the kidneys, if we do not exercise caution. Sugar, particularly fructose, is believed to induce kidney damage. High sugar consumption has been associated to multiple risk factors including elevated blood uric acid levels, diabetes, and obesity, all of which may cumulatively lead to damaged kidneys. Especially in diabetic persons, too much sugar may lead to kidney damage. In fact, after 15 years of having the disease, nearly 1/3 of diabetes patients showed symptoms of microalbuminuria, a condition of high albumin present in the urine. Moreover, less than half of them had genuine nephropathy, a condition affecting kidney functioning. However, by regulating your sugar intake, you may safeguard your health. According to the American Heart Association, males may take no more than 9 teaspoons, which is roughly 36 grams or 150 calories of added sugar each day. And for women, the maximum is 6 teaspoons, which is comparable to 25 grams or 100 calories per day. 8. Ignoring nature's call. Holding urine for lengthy durations may potentially lead to kidney damage through a process called hydronephrosis. When urine cannot flow from the kidney to the bladder, it may lead to increased pressure and edema in the kidney. Over time, this may result in diminished kidney function and perhaps chronic kidney damage. In the absence of therapy, severe hydronephrosis may culminate in failure of the kidneys, which needs the introduction of therapy such as dialysis or a kidney transplant. A research involving more than 100 female nurses, who commonly delay pee owing to lengthy working hours, discovered that those who routinely avoided the restroom actually expanded their bladder capacity. However, over time, holding a significant volume of urine may weaken pelvic floor muscles, making it difficult to regulate the need to pee. 9. Eating processed foods. When it comes to the maintenance of kidney health, nutrition is an incredibly significant element. Because of the high degree of dependency that individuals have on processed foods, you should be aware that a diet that is heavy in processed foods may create leaky gut syndrome, which in turn enhances the risk of kidney disease development. Processed meals generate harmful chemical molecules known as advanced glycation end products, which are largely to blame for this. These compounds stimulate the body's danger signals, leading to an inflammatory reaction and chronic kidney disease. A research, which included almost 14,000 participants, indicated that ultra-processed meals are connected with an increased risk of chronic kidney disease. The end result indicated a 24% increased incidence of kidney difficulties in persons who consumed the most ultra-processed meals compared to those with the lowest consumption. Each additional serving of ultra-processed meals was connected with a 5% increased risk of the illness. 10. Insufficient sleep. The sleep-wake cycle maintains kidney function by integrating the kidney's daily workload. Insufficient sleep disrupts melatonin production, which governs nocturnal processes and might damage kidney health. Sleep deprivation has been related to health conditions like hypertension, diabetes, and obesity, which lead to a declining glomerular filtration rate, a vital sign of kidney health. Several studies have found that approximately 50% of end-stage renal disease patients had sleep apnea, a disease when breathing is disrupted during sleep. This is much greater than the overall population. 11. Lack of physical activity. Most of the time, we connect physical activity with weight gain, but it also indirectly leads to chronic kidney disease. Obesity may lead to illnesses like fatty liver disease. Fat deposits in the liver and surrounding other organs, including the kidneys, may induce inflammation and scarring, which inhibits renal function. In addition to that, inactivity may result in hyperlipidemia, a disorder characterized by excessive amounts of lipids, such as cholesterol and triglycerides, in the blood. These lipids may accumulate and cause harm to the kidneys, either directly or indirectly, through linked cardiovascular illnesses. In a study combining 12 randomized controlled trials with chronic kidney disease patients, regular aerobic exercise was found to significantly improve crucial kidney health indicators. Particularly, aerobic workouts lasting over 30 minutes had a more substantial influence on the filtration rate. Walking and running, as types of exercise, were highly beneficial in lowering blood creatinine levels. 12. Excessive meat consumption. Meats are rich in sulfur-containing amino acids, which are converted into sulfuric acid, raising the acid load in the body. Chronic high acid loads may lead to metabolic acidosis, a condition that may cause kidney and the risk of developing chronic kidney disease was studied. Individuals who ate the greatest total red meat and processed meat had 73% and 99% greater probabilities of getting chronic kidney disease, respectively. Interestingly, replacing one dish of red or processed meat with low-fat dairy, almonds, healthy grains, or legumes lowered the risk of chronic kidney disease.